Well, good morning, everyone, and welcome to another live this morning. Hope you're having a great start to your day. We sure appreciate you guys coming on. We thank you for that. We love you dearly and always much appreciated. Let's see if I get some notifications here. And so I can say hello, good morning, as you get your notification. Just waiting. Here we go. Okay. Let me see here. Okay. If I can say hello to a few friends here, let me do that. And here we go. Okay. Sandy from Chilliwack, British Columbia, you're numero uno on my list. Elaine, St. John's, Newfoundland. Patricia, how are you? Having your coffee. Natalie, Brahim, you're right at the top, my friend. Tina from Windy Harrow. Nellie, Cindy from Saskatchewan. Janine from British Columbia. Carol from West Virginia. Nick from our staff. Arlene, Nativity, April, Cheryl, West Virginia. Rosa is from Montreal. Frida, Mara, Ottawa. Mary, good morning from Gander, Newfoundland. We love you dearly. And Mary, and Frida, and Rose. Did I say Rosa already? Maybe I did. Dave, Lisa, Denise, good morning. Maria, Sylvette from Hearst, Ontario, bonjour. Linda, St. Jude, Quebec, bonjour. Francis from Vaughan. Georgie, Halifax, Nova Scotia. Sandra, Karen, Lise from Sudbury. Bruno, Barry Sean, how are you? John and Linda in Fenland Falls. Nativity. Is everyone okay in Sudbury from the quake? Did we get a quake? What? Seriously, Nativity? Wanda, Carol, Judy, Elaine, Donna, Marilyn, Arlene, thank you guys. Mary, where's Kevin? Sharon, Bonnie. Brahim is saying go Mariners. Now, easy, Brahim. Game 7 tonight against the Blue Jays. Andrea, Niagara Falls. Teresa, Fran, Orangeville. And Georgie in Halifax, Nova Scotia. Anna, Marianne, Joanne, Luella, West Tennessee. Norma, Margaret. Okay, a couple of more guys. There's Wendy. She was in the clouds this morning. Margaret. Olga, we love you guys. Thanks for coming on. Patricia in Winter Like in Calgary. Coming to a theater near you. What happens in Calgary doesn't stay in Calgary. It comes east. Okay. We love you guys. Brenda, you're here, are you? And Judy in Port Perry. And Rosalinda, I missed you. Is Kevin here? Faye. Catherine. Guys, we love you dearly. Thanks for coming on. Let's finish up Q&A Friday. So it's Monday. Let's finish Q&A Monday. It's Q&A Monday. What am I talking about? Okay. We'll get to the questions here. Hold on a minute. Get off this page and get on to my emails. There we go. Okay, Barbara. I have cold sensations in my lower back, backside, top of my legs, cold to touch. I don't take meds. Seen a naturopath, doctor, chiro, and obviously Barbara, no result. Well, look, I mean, there's a couple of things that come to mind, okay? And sensations like cold and whatever can be. Have a look. Perhaps Barbara, maybe you've already looked at this. low levels of B12. And listen, I love blood tests. I do. You guys know that. I look for about 800 to 1200 in B12, but I always understood that symptoms trump blood work. Okay? Not that you guys know me. I love blood work, and I tell you what blood tests to get done. I got my top 8 that I like getting done, especially for metabolic syndrome, but really gives you an indication where you're at. I love those blood tests, and one of them is B12. And so I just always remember what my daddy told me. If it walks like a duck and talks like a duck, it's a duck. And what he said about that was the thyroid. Way back when, the thyroid, they invented the TSH test and all that. It's all right. I can look at that test, but I always look at symptoms. So if I was you, Barbara, I'd be looking at your thyroid. Might be a little bit sluggish. I'd be looking at B12 because that's your nerve vitamin. And even the cold sensations, I've seen it, can be a lack of B12, okay? Have a look at that. Okay, Marilyn, my sister's in a nursing home, okay, and the doctor, she's taking a medicine for her seizures, and the doctor said, it doesn't seem to be working, and is it possible Dr. Martin's supplements, right, due to your supplements? I would say if that's the case, it's the first time I've ever heard that. I've been accused of that, but never heard a doctor say, is it possible you're not absorbing a medication due to supplements? I can't think of one supplement that would stop a medicine from being absorbed. Now, sometimes, you'll go to a pharmacy, for example, and if you're on blood thinners, they'll tell you to take to be very careful with supplements. I never bought that because I knew better. I was in practice. I saw, there's no supplement. For example, if you take a probiotic, it'll actually help. If you're on meds, it'll help deliver your meds even more. This is why I used to tell my patients when I was in practice, I know your doctor don't want you on any supplements when you're taking chemo. That's crazy. You should be on a probiotic big time. But, don't hold your breath till they recommend it. Don't hold your breath because they won't do it. Some do it, but very rarely. But no, Marilyn, there's no reason for a supplement if you're taking DHA or B12 or vitamin D or probiotics or anything else I can think of. That's not going to affect an anti-seizure medication. It had nothing to do with that. And especially if he's using the term, maybe the medication not being absorbed due to supplement. It's an ignorance on a part of a doctor. They just don't study supplements. You might as well go to your plumber. Okay? I used to say that on my radio show for you. Go to your plumber. You'll get better advice as far as supplement. They just don't study it. And in their minds, supplements are, generally, okay, medicine, in their minds, it's a waste of time and money. But I'll tell you something. Most physicians take supplements. Isn't that amazing? Most physicians take supplements. And if they don't, they're fools. They won't recommend them, but they take them. I told you about the time I used to give courses. They invited me for years. I'd give Nutrition 101 and they would get accreditation. I remember sitting one time, I think I was in Montreal, doing these courses. I was one of the speakers. And if they go spend 2 days there, they could do all their education they needed for the year. Like doctors have to get so many hours of postgraduate education just to keep their license up, right? So this company I worked for, I was just a consultant to them. They would bring in doctors or whatever in a 2-day setting, and you get all your hours that you needed. So doctors would come, and in Montreal or Toronto, I did it in Toronto, I did it in Montreal. And I remember one time, okay, and I do a lot of repetition, guys, so this is a story you might have heard of before. But I think there was about 150 cardiologists in a room. And I'd go after them because they knew nothing about nutrition. Nothing. Okay? They knew nothing. Anyway, I said, okay, how many of you guys take omega-3? Almost all of them put their hands up. Almost all of them put their hands up. How many of you are taking omega-3? Hands would go up. Almost all. Not all, but almost all. I said, how many of you are recommending omega-3 to your patients? And only 1 or 2 hands went up. I said, you're a bunch of hypocrites. I told them right to their face, you're hypocrites. You take omega-3. You know it's good for your heart. You're a cardiologist. You do it, but you don't tell your patients to do it. And I remember one of the cardiologists said to me afterwards, yeah, but if we do, we can get in trouble with our college of physicians and surgeons. Oh, I got a migraine right on the spot. How silly that is. Every person on the planet ought to be taking vitamin D. Every person on the planet. Every person on the planet should be taking a probiotic. But don't hold your breath for medicine to tell you to do it. If they knew, even studied the research on DHA, for example, there wouldn't be a doctor in the world that didn't take that stuff and recommend it to their patients. Anywho, don't get me going. Okay, so Marilyn, be very nice to your doctor, but you tell her, him, Dr. Martin said, you don't know what you're talking about. In a nice way, okay? Say it nice. Okay. Denise, I got milia. What's milia? Everybody's asking. That's little spots. You can get they're like little bumps that come up, and they usually come up below the eyes here and whatever. Milia. Denise. Usually when that comes out. What comes out on the skin, you got to go from the inside to the outside. Okay? Your skin is just another organ. It's your largest organ. What happens in Vegas doesn't stay in Vegas. What happens in your gut doesn't stay in your gut. If you get leaky gut, you can get leaky skin. And generally with milia, is that how you pronounce it? I don't know. I don't care. I really don't. How to pronounce it. But if you get it, always go to the inside. Inside out. Skin, inside. Gut. Leaky gut, leaky skin. Usually fungal. It's the invasion of the Trojan horse. Yeast, fungus, candida gets into the bloodstream, comes out in the skin. Whenever I saw psoriasis, eczema, dermatitis, always back to the gut. Always back to the gut. Okay? Start there. Okay. Brian, since October is Breast Cancer Month, can you talk more about mammograms and the difference between that and thermography? Look, I'm going to give you some generalities, okay? Generalities. That it's, Brian, and I touched on this last week, okay? So there's 2 episodes. They'll be out very shortly on our podcast, okay? So when you go to the Doctor is In podcast, there's 2 recent episodes that'll be posted within the next few days on breast cancer. And I talked all about it, okay? What did I do? I did this, okay? Just getting out my notes so that we can, breast cancer. What, the causes and what to do. All came from a study that came out on breast cancer, and we looked into all of it. The increase in estrogen in the world, it's a growth hormone. The increase in insulin in the world, it's a growth hormone, okay? The lack of vitamin D, the increase in stress, cortisol. That's what we talked about as causes. Why? We looked at our environment. We looked at what we're eating. We look at what the stress of the modern day woman experiences. Pouring gasoline on the fire of inflammation. We talked about oxalates, that people are eating way too many oxalates. They can end up in your breast tissue. Okay? They're anti-nutrients. Oxalates. And we talked about that. And what to do. Okay? So we had a whole session on what to do. Get your vitamin D up. Get it. And I told you what numbers to shoot for. Okay? At least over 60 in the United States. NGML and 180 250 to 250 in Canada, okay? NMOLL. Ooh, I hate those terms. How to confuse the world. So people can't read their own blood work. They made it so silly. Anyway. It's the way it is. So you have to sort of educate yourself if you want to be able to look at your blood test. And this is why I tell you over and over and over again. I tell you this over and over and over again. What? Okay? Get my book. Get our book, Sun, Steak, and Steel. Okay? Sun, Steak, and Steel, and Sleep. Get that because I have the blood test I want you to get. Okay? Including your vitamin D. Dim out, Sun, Steak, Steel, and Sleep. Drink coffee. Diet. Cut out that stinking high fructose corn syrup. And now you're asking me, and I touched on this last week, the difference, because I showed you pictures of thermography that I used to do in my office. Now, it was a tool. Thermography is a tool in the toolbox. It's not everything. Okay? It's not everything. I like it because I had a very specialized thermography that looked at estrogen on the skin. It was wonderful to behold. Amazing. But thermography, it's a heat detector. And if you got extra heat in an area around the breast, that is an indicator that something possibly is going on there. Okay? They cool you down, and then if you've got inflammation or redness, okay? I'll show you again if I can find it real quick here. Okay? So, okay, that's thermography. See the red? Okay? See the red? That's thermography. Is it everything in diagnostic? No. Okay? I think that medicine should use it more because I think, and listen, this is, I'm only repeating what, like I think it's in Switzerland, somewhere in the Netherlands anyway, they've actually banned mammograms. I brought that to you. Now that's not me, guys. But they're just saying the risk of the mammogram, it outweighs in Switzerland. It outweighs the benefits of a mammogram. Because mammogram, the problem with them is you get an enormous amount of radiation. Enormous amount of radiation. And then, okay, so one, enormous amount of radiation. Two, okay? Two, you get so many false positives, either because of dense tissue or oxalates or whatever, and they you know, then they want to do a biopsy. And guys, listen, you just got to understand, I'm giving out information, okay? I'm not talking to you as an individual. I'm giving out general information. So you got to weigh that. You got to weigh that. And, you know, because a lot of people, they get biopsies done, and remember, you puncture a tumor that's encapsulated, meaning the body was taking care of it. It was encapsulated. But we live in a world that is so detection replaces prevention. Detection replaces prevention. I'm prevention. I'm not against detection. I just like prevention, the emphasis on prevention of breast cancer. Okay? The emphasis on the prevention of prostate cancer. On the emphasis on the prevention of it. Now listen, you get a diagnosis and you got decisions to make. You got decisions to make. I get that. So I'm not trying to disparage anyone as an individual. I'm just giving general information. Thermography, it's a tool in a toolbox. It's not everything. It's not everything. But I recommend it. Okay, for women especially. I recommend it. It's a good thing to look at. See if you've got anything that's possibly, because that's prevention. I've seen thousands of patients that lit up like a Christmas tree on thermography, had estrogen coming out the wazoo. And then we dimmed it out. Proven. Okay, proven. I could show them on a scan, before and after. It was incredible. I even had a couple of oncologists that were interested and fascinated by that. How did you get rid of that estrogen? I dimmed it out. The same thing that you use for you use in the medication tamoxifen, which is, you know, wipes out your estrogen. The problem with tamoxifen is it's got a million side effects. A lot of women just can't take it. Better to dim it out. Use flax seeds in our menopausal formula. It's got the dim in it. Even men I put on menopausal to take the estrogen away for their prostate. Anywho, okay. I got sidetracked a little bit, but we enjoyed it. I enjoyed it. Okay, so that was Brian. Brian, you wanted me to talk about Breast Cancer Month? Okay, I just did. Okay, so stay tuned. Have a look. There'll be a couple of episodes on breast cancer, everything breast cancer, coming to our podcast, which are the Doctors in Podcast on your favorite smart device. Thank you, Brian, for the question. Let me see. Teresa, I just had 13 inches of my colon removed due to diverticulitis. No fun under the sun. And I seen that thousands of times. Diverticulosis becoming diverticulitis, and infection gets in because you have a little bit of feces that gets into those little burrows in the large intestine, and you can get and very serious stuff. You can get sepsis from diverticulitis. Okay, so you got no choice at that stage to get on antibiotics. And hey, they actually said it was so bad because it disintegrates. They took out 13 inches. Okay. Should I stay with EMC, eggs, meat, and cheese, or do I need fiber? Well, I'm not a big fiber fan. Okay? Look, it's not that I don't. Drink coffee and water. Those are your best fibers. Okay? Drink coffee and water. I understand the thinking. Okay, so you have to, this is the way I was trained too, right? You need fiber. Why? Because fiber, the more fiber you have, the more that fiber sort of brushes out your colon. Okay? Fiber equals bulk. Bulk equals cleaning the bowel. No. Okay? I was always against that. Why was I against it? Well, fiber caused diverticulosis. What? Well, your body wasn't designed for salad. Okay? A cow eats salad, but a cow has 4 stomachs. That's what it takes to break down vegetables. No, I'm not saying all vegetables, okay? What gets caught in your teeth? Spinach. Okay? What gets caught in your teeth? Spinach. It gets caught in your bowel too. And so when they insist that you eat fiber, and lots of it, that came from Dr. Kellogg's. Okay, you have to understand, I've been around for a long time. I watched them do it. Okay, let's change our breakfast. Okay, let's change it. I watched them change it right before my eyeballs. Okay, eat cereal, not bacon and eggs. Why? Well, because cereal has no cholesterol. Cereal is full of fiber, and fiber's going to clean your bowel. And then they tell you this. Here's another pit, live from the pit, I call it. Fiber feeds your friendly bacteria. Without fiber, you're not going to have any prebiotics. I heard that a million times. I said the best prebiotic is steak. That feeds your friendly bacteria. Okay? That's the best one. Now, I know that goes against the grain. I know that that's not what's taught, but I'm telling you, I had people with diverticulosis and for years of bowel trouble, IBS and IBD and ulcerative colitis. And I said, you got a sunburn in your gut. Would you stop using sandpaper down there like fiber? You're eating too much fiber. And then I would have a pile of people, and diverticulosis usually, it's not always, is in women. Hello? I'm a why guy. Why is diverticulosis mostly in women? Why? They love salad. They love vitamin S. They think it's salad. Vitamin S is steak, not salad. Your body wasn't designed. So you bulk up your stool all right, and that irritates your bowel big time. And I used to get, over the years, probably 5,000 women, more. Arrête. That was French. Stop. You're going to stop eating salad. Okay? Because you got diverticulosis. It's getting caught. Drink water. Okay. You like coffee? Yeah? Well, drink it. Because that's your fiber. And that's a fact. Coffee is fiber. It's the only one you need with water. That was me. That was my teaching. And I'll tell you what. I put my results up against any practitioner. Said, you want to save your bowel? You want to stop from the fact that you might lose, what did Teresa lose? 13 inches? You want to stop? You want to stop that? Well, quit eating all that fiber. Your body was never made for that. You weren't made to eat cereal. Cereal's man-made. Well, Dr. Martin, it's oatmeal. Are you a horse? And then women, men do it too, but mostly women. They eat a lot of seeds. Dr. McKenna, I love my almonds. Yeah, I know, but they irritate the bowel. Have a little bit, but not much. You can have some flaxseed, because that helps your estrogen. Lay off the other seeds, the pumpkin seeds and all. You can have a little bit, but not much. Your bowel wasn't made for all that stuff. You're not a chipmunk. You're not a squirrel. You're not a horse. Oats are for horses. Of course. I'm a horse, of course. Remember that? Okay. Teresa. I think I answered this the other day with Kevin. I think I might be done, guys. Kevin was asking about CAC scoring, okay? The coronary artery calcium score. Look, Kevin, I think I answered it properly the other day. I'm not against it. It bothers me in a sense because, look, it should be very preventative, and I'm not against getting that done. But I find it's like a mammogram. Is it good? Yeah. Okay. But it's not good if they over-treat something that makes it worse. And for example, with the CAC score, I've had way too many people, and now they're on statin drugs because we found some atherosclerosis, and oh my, now we gotta your coronary arteries are all calcified, and now we're going to put you on. Like if they put them on high DHA and Nabitol and cut the sugar out of their diet, then I'd be all for it. Anyway, I just think they overtreat after that. That's me. Okay. Okay, guys. I had fun. I don't know about you. Okay. Okay, so we got a great week lined up. Want to hear from you? Keep it coming. We'll talk to you soon.